Anxiety disorders are a critical focus for mental health professionals, and this episode complements therapy training's 5 CE Hours Treating Anxiety Training 2023. We'll explore the theoretical foundations of anxiety, discuss evidence based interventions, examine the role of psychopharmacology, and highlight the importance of cultural competence in treatment. These insights aim to enrich your understanding and approach to managing anxiety in your practice. Let's start by discussing the theoretical foundations of anxiety disorders. Anxiety is a complex experience, and understanding its neurobiological, cognitive, and behavioral aspects is essential for effective treatment. On the neurobiological level, anxiety disorders often involve dysregulations in neurotransmitters like serotonin, dopamine, and norepinephrine. This imbalance can lead to heightened states of arousal or a feeling of being constantly on edge. The amygdala, our brain's fear center, plays a vital role in processing emotions and triggering our fight or flight response. When this system is overactive, it can contribute to the symptoms we see in anxiety disorders. From a cognitive perspective, thoughts and beliefs can greatly influence how a person experiences anxiety. For instance, someone with generalized anxiety disorder often has a tendency to catastrophize, believing that the worst will happen in any situation. Understanding these cognitive patterns allows us as mental health professionals to address and reframe these thoughts through interventions such as cognitive behavioral therapy, or CBT. And let's not forget about the behavioral aspect. Anxiety often leads to avoidance behaviors. Think about it. When faced with something that triggers anxiety, our instinct is often to avoid it. This avoidance can provide immediate relief, but ultimately reinforces the anxiety cycle. By understanding these theoretical underpinnings, we can develop more effective, evidence-based treatment approaches for our clients. Now, speaking of evidence-based treatments, let's delve deeper into some of the main interventions you might implement in your practice. First up is cognitive behavioral therapy. CBT is incredibly effective for anxiety disorders as it addresses both cognitive distortions and avoidance behaviors. Through structured sessions, therapists can help clients identify negative thought patterns and gradually expose them to the situations they fear, helping to reduce anxiety over time. Next, we have exposure therapy, which is particularly beneficial for conditions like specific phobias and social anxiety disorder. The idea here is to expose clients to the source of their fear in a controlled and gradual manner. This approach helps desensitize them to the anxiety-provoking stimuli, ultimately leading to increased confidence and coping skills. It's important to remember that this process can be challenging for clients, so providing a supportive environment is key. Mindfulness-based stress reduction, or MBSR, is another powerful intervention. This approach encourages clients to focus on the present moment and develop a non-judgmental awareness of their thoughts and feelings. It's particularly helpful for those who find themselves caught in a cycle of worry about the future. Mindfulness can help clients cultivate a sense of calm and reduce anxiety symptoms over time. Now let's shift gears and talk about the role of psychopharmacology in treating anxiety. While therapy is a cornerstone of treatment, medications can sometimes be necessary, particularly for clients with moderate to severe anxiety disorders. Common medication options include selective serotonin reuptake inhibitors, or SSRIs, and benzodiazepines. SSRIs are often first-line treatments as they can help regulate mood without the risk of dependency associated with benzodiazepines. However, it's essential to have open conversations about potential side effects and the importance of a collaborative approach with prescribing professionals. As therapists, our role is not just to implement therapy. We also need to ensure that our clients are receiving comprehensive care that addresses all aspects of their well-being. Now, let's take a moment to discuss some specific anxiety disorders you might encounter in your practice. Generalized anxiety disorder, or GAD, is characterized by excessive worry about various aspects of life, including work, health, and relationships. Clients may benefit from CBT, mindfulness techniques, and even lifestyle changes like regular exercise and proper sleep hygiene. Panic disorder, on the other hand, involves recurrent panic attacks, which can be terrifying for clients. Here, CBT and exposure therapy can be invaluable in helping clients manage their symptoms and understand the physical sensations associated with panic attacks. Social anxiety disorder often manifests as an intense fear of social situations. Group therapy can be particularly useful for these clients, providing a safe space to practice social interactions. And then there's obsessive compulsive disorder, or OCD, which is characterized by intrusive thoughts and compulsive behaviors. Cognitive behavioral therapy, specifically exposure and response prevention, is the gold standard for treating OCD. It's crucial to tailor these interventions to each client's unique needs, as no two experiences with anxiety are the same. Now let's touch on a very important topic: cultural competence in anxiety treatment. As mental health professionals, we must recognize that anxiety can present differently across cultural backgrounds. What may be perceived as anxiety in one culture could be expressed as somatic symptoms in another. It's crucial to approach each client with cultural sensitivity and an understanding of their unique experiences. Incorporating culturally competent practices can enhance the therapeutic relationship and lead to better outcomes. This might include exploring how cultural beliefs influence a client's perception of anxiety, as well as being aware of any stigma associated with mental health in their community. By adopting a culturally inclusive perspective, we can provide more effective, personalized care. As we approach the conclusion of our discussion today, I want to take a moment to address some common misconceptions about anxiety treatment. One misconception is that medication is the only effective treatment for anxiety. While medications can play a vital role, therapy, particularly evidence-based approaches like CBT and mindfulness, can be just as powerful, if not more so, in the long run. Another misconception is that all anxiety disorders are treated the same way. As we've discussed, each disorder has its unique characteristics and requires tailored approaches. Lastly, let's talk about self-care for mental health professionals. Working with anxious clients can be emotionally taxing. It's essential to prioritize your own well-being. Implementing stress management techniques, setting clear boundaries, and engaging in regular debriefing practices can help prevent burnout. Remember, you can only pour into others' cups if your own cup is full. As we wrap up this episode, I hope you've gained valuable insights into the treatment of anxiety disorders. The course offered by Therapy Trainings provides a comprehensive overview of these topics, equipping you with the knowledge and skills to help your clients effectively. I encourage you to visit therapytrainings.com to learn more about this course and other valuable training opportunities. Remember, enhancing your knowledge not only benefits your professional development, but also transforms the lives of those you serve. Thank you for joining me today. I look forward to our next conversation and wish you all the best as you continue your journey in mental health practice. Take care.